Hello, I'm Dr. James Babowice. I'm a board-certified general surgeon with Hartford Healthcare Medical Group. Well, a general surgeon's a doctor who takes care of all kinds of problems with surgery, mostly problems inside the abdomen, with appendix, gallbladder, colon, and then issues like hernia. Oftentimes people will come with you with like a pre-labeled diagnosis, problem, or issue, and I think that a lot of people when they come to the doctor's office, are anxious about that experience and what that means. I think that you need to be a good listener and make an effort to hear what people are saying to you and put their priorities first, whatever that may be. I'm a surgeon, and I always take pleasure in having the opportunity to treat problems with surgery. But I think you really need to listen carefully to people and make sure that you're hearing them and not trying to funnel them into something that they may or may not want, whether that's surgery or medication or anything. I think that people's needs come first. When I was a second year resident, I had the opportunity to go to Guatemala as part of a medical mission trip and see patients who lived in a rural area where they had very little access to medical care and surgical care in particular. I think that gave me a strong desire to provide community general surgery needs to my community and deliver those kinds of interventions to the people around me. One thing that patients should know is that, at the end of the day, I work for them, right? And I think that's true of every doctor, is that it's our responsibility to keep them safe and, fulfill their needs and their health needs in particular. I would tell referring providers that we work together, and that work, exists both in the hospital and in the operating room and continues long after patients leave the hospital and are getting primary care. It's our responsibility and our opportunity to work together to make sure that our patients here in the region are having their community health needs addressed longitudinally. When I'm not at work, my wife and I love to spend time outdoors. I think that that's, our great satisfaction, and it makes us both very happy to be able to do that. I'd like to think that those experiences remind me that there's a life outside of the clinic and the hospital for all of our patients too, and it's our responsibility to get them back there to doing the things they love.